everyone. This is Dr. Shama Tazara, and today our topic of discussion will be very interesting and very fascinating for pathologists to see under the microscope. So, this is infections of the central nervous system. So, it's always cool when we see organisms under the microscope, and I personally get very fascinated and I enjoy that. Not good for patients, but like we being pathologists enjoy it. So, let's dive in. That's our topic today. So this is the third lecture on our series of infections of central nervous system, and the topic of presentation today will be subacute sclerosing panencephalitis, also called SSPE. So it's caused by measles virus. Starting with the scenario, same pattern. So it's a young patient who presented with focal neurological deficits. This is how it's presented: focal neurologic deficits in young patient. Moving on. So the MRI was done on the patient, and that shows these white matter hyperintensities. You see here these well-defined white matter hyperintensities. This is how it shows. Further on, macroscopic findings, it shows cerebral atrophy and white matter discoloration. Microscopically, how would this whole would look microscopically? First finding are these perivascular lymphocytes or microglial clusters. So this is a blood vessel. These are all the lymphocytes at low power. When seen at high power, you can clearly see this area, the whole lymphocyte clusters, also microglias, which are the macrophages of central nervous system. They are also forming clusters here. This is shown clearly here, one finding. Moving on, again, this is another good picture taken from expert path. So this is the vessel, lymphocyte infiltrate surrounding it, causing this perivascular cuffing, and these are the glial cells, which shows reactive gliosis. These glial cells with this bright pink cytoplasm, which is normally not seen if they are not reactive. So that's why they are reactive gliosis, and it's intense because we see many of them surroundingly. And other findings are the glassy intranuclear viral inclusion. So at low power, you won't appreciate here, but there are glassy intranuclear inclusions. Higher power of this image, it shows these very clear within these are the neurons in this nucleus. We see these pink glassy intranuclear inclusions, and the further higher view showed this, that these are those intranuclear eosinophilic inclusions, and they are distinct from owl's eye cowrie type A appearance. Yeah, so moving on, again, the reactive gliosis, that slide also shows these reactive glial cells in the surrounding. So in late stage of SSPE, what happens, the large neurons can also have neurofibrillary tangles around it, and this is a finding seen here. These are the neurons and these are the tangles. These are eosinophilic protrusions surrounding the neurons. These are basically neurofibrillary tangles. Pathogenesis. So how the SSPE develops. So it's a chronic progressive encephalitis that follows exposure to the measles several years later. So mostly it occurs in children who have contracted this infection in less than 18 months of age, and usually early infection is of course less than 2 years of age, but virus is incompletely cleared from the body. So smoldering infection results, which is an infection that is persistent, low grade, and not causing any acute symptoms. And SSPE that manifests usually more than 6 to 8 years later after the initial presentation. Average age of onset is like 5 to 15 years of age, and risk can be reduced up to 10 to 20 times if measles vaccination is done. So this is the whole pathogenesis of it. Brief summary: if early infection occur less than 18 months of age, later on virus is not cleared completely from the body and further progress to smoldering infection, which is slowly progressive infection, and this usually occurs like 6 to 8 years later after the initial infection, and average age is 5 to 15 years of age. How would this patient presents? The course of disease is variable. It can either cause death within a month or can progress only just at intermittent rate. There are clinical staging of SSP. So first stage, there will be just like intellectual impairment and some behavioral changes observed in the patient. If it's further progressed, then repetitive symmetric means bilateral myoclonic jerks every 5 to 10 seconds. Patient would have those signs. Further, if it's progressed to the stage 3, now it is becoming severe. Increased mental deterioration, development of various combinations of ataxia, spasticities like spasm, choreoathetosis, abnormal movements, dystonia, contractures, persistent contraction of a muscle, gradual disappearance of myoclonus, which was first in the second stage, and at the fourth stage there will be like autonomic disturbances, stupor, coma, and even patient can cause death can occur in the patient. This is the summary of the whole case, that it's caused by measles virus, occurs if an initial infection is less than 18 months of age. It affects the gray or white matter of the brain, and on H&E we would see reactive gliosis in the surrounding, perivascular lymphocytic infiltrate, neuron loss with glassy intranuclear viral inclusions. These are characteristic of SSPE, and in late stages we can see neurofibrillary tangles. So this is the whole overview. So this is all for today. Thank you everyone for your attention and patience, and I want to special thanks my attending Dr. Daniel A. Child and my fellows of neuropath in University of Washington, which are Dr. Alex, Joyce, and Lucy. They helped me a lot in preparing this whole presentation, so thank you to them. And I hope you guys liked the video. If you did, just tell me in the comments, and do let me know if you need some other topics of discussion specifically, and share any feedback. If I did something wrong, please correct me out, and thank you so much. So these are like some nice views of Vision Point at Seattle, the nice downtown view, the nice sea view from top. So bye bye, take care. I'll see you in the next video, probably the infection series. Stay tuned.